right, we're live. All right. Welcome to episode 4, Alternative Medicine. I'm Dave Deming, and I'm joined here by Lebaron and Dave, who already gave his patented wave.
It's the wave of justice.
It's going to be the wave of the smackdown and all this BS we're going to be talking about tonight. So tonight's topics is going to include everything from chiropractors to yoga to Reiki, whatever.
Reiki, crystal healing,
It's a hand healing or whatever.
distance healing.
I don't know.
I'm not sure.
It's a bunch of BS in my opinion. But, you know, people buy it, and Lee's going to... This is kind of like your pet project,
This
your little
is,
pet peeve about
this is
medicine.
like alternative medicine is kind of like a thorn in my side. It's when I used to work in a pharmacy, it'd be every time someone would come in and was like, "Hey, I really want to lose weight. Like, what can I do?" And I'm like, "There's this thing called diet and exercise. It's really good for you. You should try it."
You should meet Mr. Pukey.
Right? No, I wouldn't.
All the Hollywood star that's nice and
I
thin.
wouldn't recommend. I've never heard that before in my life, Mr. Pukey. But it would be like, well, I'm looking for this. Is this fat burning supplement good for me? And I'll tell you, no, it's not. You're not going to lose weight.
Unless
it's
it's
mostly
a
caffeine based. Right, unless it's that.
Then you run the risk of a heart attack. But, you know, heart attack, weight loss, it's all the same thing. So
Yes, tomato, banana.
Either you're going to die from taking ephedra or you're going to die from the heart attack that your fat is going to give you. Right?
I mean,
I'm obviously kidding.
Yeah.
But let's start off by giving a little disclaimer, and I didn't mention this to you before we started, but anything that we say here should be taken with a grain of salt because we're not MDs, we're not practicing clinicians, we're just going to give you the science behind, or the lack thereof, of alternative medicine in comparison to what everybody considers, Big Pharma shills like we are, Western medicine. I'm still waiting for my paycheck, GlaxoSmithKline. So, But
Right. I
just want to give that disclaimer. We're not MDs. If you're ever going to start a new diet program, a new exercise program, please consult the right professional, such as your family practice physician, to see if you have high cholesterol, high blood pressure, what your limitations are, if you have any injuries. And then, honestly, I'm going to put a plug in because I was a personal trainer for years, is talk to a personal trainer. You don't have to pick the first one that you sit down and talk with. You obviously want to go in with a list of questions. What are their credentials? What are their certifications? What are, what knowledge base do they have? Kind of like see what they're going to offer you, and don't necessarily pick the first person. Like I said,
not to knock personal trainers, but on my list of people to get advice from as far as health is concerned, it's physicians who have MDs, then it's nutritionists.
No, dietitians.
Dietitians.
Not nutritionists. Nutritionists are just like personal trainers. You can get a $100 certification.
Really, to be a nutritionist?
Yes.
Right, a dietitian is actually a bachelor's degree or more.
Master's degree.
Don't they have bachelor's in that?
You can, but
I wouldn't call it dietitian tree.
No,
What do you
you're
dietary
a
science?
clinical dietitian.
There we go.
So dietitians are people that, if you have cancer, if you have like type 1 diabetes, stemming from type 2 diabetes, and stemming from like all the other things, that phenylketonuria, things where you can't process certain chemicals or certain products. So those are the people you would talk to. But what I mean is, if you find a good personal trainer to give you a workout program, obviously that's the last person you're going to talk to. Talk to your clinician, like I said, talk to a dietitian, and then obviously a personal trainer if they have the qualifications that are necessary. The best personal training certification that I know of for a baseline personal trainer is NASM, North American Sports Medicine.
I don't know. I mean, people actually can get PhDs in nutrition and exercise science and things of that sort.
Exercise physiology.
So, I mean, it's not as if there's not people with knowledge out there, but
if you're
the
like a
disclaimer
common person, you know what I mean?
Don't listen to somebody that's trying to sell you something.
Exactly.
That's kind of like the rule of thumb.
All right, so let's give a nice little streamlined definition as to what is alternative medicine. And I'm going to read off the slide behind me. If a non-mainstream practice is used together with conventional medicine, such as Western medicine, like statins for cholesterol and high blood pressure medications, different things like that, it's considered complementary. If it's a non-mainstream practice used in place of conventional medicine, it's considered an alternative. So basically, if you say, I have high blood pressure, I'm going to do yoga and that's going to cure it, you're in the alternative category. But if you're going to say, hey, I have high blood pressure, but I'm taking my normal medication daily, I'm on a good diet that's prescribed to me by a registered dietitian, certified dietitian, and you're going to do yoga as well, that's complementary.
Go for it.
I do that. I know that you work out. I do yoga.
I really like to start doing yoga, but
I like it. It's kind of like me time, where you just kind of like just veg out while you're doing a little exercise. Yoga is hard as hell if you do it right.
Me time consists of Chinese food and televisions, which I'm sure that's some brand of yoga that
me
isn't
time.
as
Me
popular.
time for Lee is a little more me-ish, if you will. But you know what I mean? But I know people who subscribe to doing yoga and really just even just acupuncture. I have a friend that does acupuncture, and she swears by it because she's had chronic foot pain. And I know that you want to jump off and it's placebo effect and everything else, but I know a bunch of people that go to chiropractors and they feel better and different things like that.
I mean, here's my thing though. We're going to get into the chiropractic thing in detail, but I mean, as far as pain is kind of, first of all, almost half, I would say.
100% of pain is in your brain.
Right. I mean,
Remember
essentially,
that.
like opiates work on a mu receptor and they change your perception of pain. Alcohol changes your perception of pain.
Marijuana changes your perception.
Right. All these things change your perception of pain. Outside of things that are numbing agents like lidocaine, novocaine, these things actually work with signaling associated with pain. But yeah, so when somebody does acupuncture on you, I mean, clinical studies have shown that acupuncture is just as good as sham acupuncture, meaning that they don't actually use a needle, and it's just as effective, and you're not having a needle put in you. That means that it's all in your head.
However, if you get a benefit from it, I'm not going to tell you stop doing it, because the placebo effect is a real thing, and we'll get into that. But integrative medicine, there are many definitions to integrative healthcare, but all involve bringing conventional and complementary approaches together in a coordinated way. And the NIH actually has a website devoted towards this integrative medicine and this integrative approach, where they're actually trying to give more funding into the research of supplements, herbs, probiotics, yoga, chiropractic, and meditation, massage therapy, acupuncture, and they really do try to take a scientific approach to try to see if these things are actually true or false, if they actually have benefits or not.
I think that we spend, me and you may have a disagreement on this practice, rather. The federal government, the NIH, the National Institutes of Health, has many divisions. One of these divisions is devoted to the scientific investigation of complementary and integrative medicines, which include things like herbs, spices, whatever you want, teas, back rubs, Reiki.
Did you ever play Resident Evil growing up?
Maybe.
So in that game, like if you get bit by a zombie or whatever, the way that you heal yourself is green herb. little green herb.
Right. That's the cure for zombiness.
Yeah, make you a zombie.
I mean,
but in all honesty, I don't have a problem with complementary medicine. Integrating these different things, because if it benefits you, it benefits you. Yeah, but at the same time, I don't like these charlatans like this David Wolfe or whatever that guy's
David
name
Wolfe?
is.
Yeah, David Avocado.
No. Wolfe.
Wolfe?
Oh,
I'm sorry.
I don't even want to.
Dr. Oz?
Dr. Oz. Any of these guys who really don't have a degree or anything, or
Dr. Oz is an MD. He's just he's a shill.
He's
actually a shill.
And that's the other thing. All these people call us shills in the pharmaceutical industry, but you're going to bring up this valid point about how they make billions of dollars every year doing these types of alternative medicines. And before we get into your little list here, let's talk about what actually the complementary and alternative medicines include. And then I'll let you jump in.
Somebody asked, does acupuncture work? We're going to talk about that.
So big thing is meditation, hypnosis. And hypnosis has been actually shown in psychiatric fields to give some benefit, especially with PTSD.
I think dog walking probably is just as effective as hypnosis. It's one of these things where it's kind of like any level of intervention associated with mental health is, one, it's harder to duplicate because it's so independent on a person's own psychiatric well-being. And a lot of the times, a study came out almost 2 years ago that almost, half of clinical psychology journals couldn't be repeated.
Oh yeah, there is no reproducibility in it. Yeah,
I
but
mean,
there's also a lot of
that's not their fault.
But there's a lot of biological sciences, such as the fields that we're in, that have a lot of low reproducibility because people are charlatans. And like it's in anything, but there is a high degree of non-reproducibility.
I mean, there is definitely a high degree of reproducibility.
So if we're gonna,
but psychiatric stuff is kind of like, I pretty much take any practice associated with psychology as a grain of salt.
Yeah, I wouldn't take ours as much, but there are some things that in my hands, and I heard somebody say, you know, in my lab's hands, this is what we saw. In my lab's hands is the result.
Yeah,
Because
I call that trash.
No, that's
I mean, if other labs can't reproduce, I mean, people get Nobel Prizes because other labs can reproduce your stuff, right? I mean, shout out to the people that just recently won Nobel Prizes. Could you imagine if cryo-EM only worked in one place?
Fair. And I'm not saying that, but in certain circumstances, like in cancer research, a certain cell line against new mutations and certain treatments might not work as effectively in another lab. However,
Right, but there's a scientific explanation for that, and
Exactly.
it's not
no.
the specialness of that place.
I got you. But that's another problem with the social sciences like anthropology, psychology, and sociology is that it's all very statistically based, and it's statistics that are kind of like pulled out of thin air. Basically,
I mean,
here's a variable, like this person comes in, they have X, Y, and Z, a psychological disorder. Not every psychological disorder that's attributed, say, I don't know, schizophrenia, is going to be exactly the same.
Correct.
So there's variation in just that. So they have to take...
I mean, the social sciences have the most variability associated with them amongst everything. It's really easy and exact to measure enzymatic kinetics, but it's really hard to measure the level of craziness of a person, right? I mean, like, it's a spectrum, pretty much. Does acupuncture work? Yeah, we're going to get to that in detail.
Yeah, we're going to get to that real soon. Let's just get through it. Guided imagery, biofeedback, relaxation therapy. I don't even know what CBT means. I think that might be a drug. Homeopathy, I know is real BS.
Trash.
It's trash. Basically, it's the using 1/1000th of whatever substance, say a flower has whatever outcome, chrysanthemum root, because that's in like C4 and like all these like pre-workouts, and it makes your heart go, but makes you lift a lot. But it's like taking 1/100000th of a chrysanthemum root and putting it into water. And
Yeah, I mean, the concept of homeopathy is kind of against all basic understanding of science, but...
Acupuncture we mentioned, physical medicine, chiropractic therapy, Ayurvedic medicine, I think that's like yoga and stuff like that. From
That's
India.
like some,
Dietary, herbal, massage therapy. Although, you know, have you ever gotten a massage?
Pain.
Feels great.
I mean, just for pain, though, your hypertension isn't going to go away.
Yeah, fair.
I think there's a clear point that we want to make here. A lot of these stuff that chiropractic, massage therapy, like these things have been shown to be effective for neck and back pain in a bunch of different studies. The problem I have with chiropractors is that when you come in and say, I have a cold, I have the flu, somehow they think by spinal manipulation, they're going to help your flu out.
Yeah, and the other flip side to
That's retarded.
Yeah, that is. And the flip side to chiropractic medicine is that once you pop, you can't stop. Like literally, once they crack your back and go pop, 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 you may feel well for a week or two, but then you're going to start to feel pain, lower back pain again, and they have you hooked.
Well, yeah, it's a very, I mean, it's not, I don't think medicine as a whole is a one-shot fix except for antibiotics and cancer therapeutics, which essentially are designed to kill things. Everything else is not really meant to cure your disease state, especially when you have a chronic disease. Now, there are some exceptions, hepatitis C, there's cures for that now, there's cures for some viral-mediated diseases, but your hypertension, those drugs aren't designed to take away your hypertension forever.
Even though antibiotics, you say, is like a cure, it's not necessarily, it's just killing bacteria enough so that your immune system can take over and clear out the rest.
Well,
if you think about it, that's literally what antibiotics do.
Well, there are two classes of antibiotics broadly, bactericidal and bacteriostatic drugs. Bacteriostatic drugs stop bacteria from growing. So if you have a functional immune system, because there's no more growth, assuming that there's not actually a biological or biochemical mechanism associated with that bacteria, the immune system is going to clear the infection. No. Bactericidal stuff is actually going to kill everything that is susceptible to that drug, including your own floral bacteria. So in that sense, yeah, like Vanco is there to kill shit. Like,
but at the same time,
if you didn't have an immune system, would you still come over that disease? I don't know. It's hard to say, right? Because from a resistance perspective...
And I'm not a clinician, so that's the other flip side to it. So
I mean, I know a lot about as far as the way these. I would say strongly that even if you had a horrible immune system, bone marrow transplant, some shit like that, and you had an infection, where at that point we're not relying on your immune system to even be functional, especially if you're a chemotherapy patient or you just received a bone marrow transplant or you have some immunocompromising disease. We need antibiotics to kill whatever it is because you're immune deficient.
Yeah.
So
that's why, like in adjuvant therapy, the chemotherapeutics is that why you always get antibiotics.
Yeah, a lot of the times because your immune system takes a shit, like your hair and stomach cells.
So
yeah, back to this crap.
Let's talk a little bit. Like, all right, I'll give you the top 10 natural products, which are BS. How much money do people spend a year on natural products? There, Lee. I know you got that right.
$33.9 billion is the market for complementary and alternative medicine products, classes, materials, and practitioners.
So they're making lots of money too. So that's the other flip side to this is that, everybody attacks Western medicine, pharmaceutical companies, that they're making billions and billions and billions of dollars. But the alternative is also making billions and billions and billions of dollars.
I mean, so supplement, vitamins, and natural products of that 33.9 account for $15.4 billion.
How much?
So 15.4. So almost half the total money spent is on vitamins and supplements.
That's only 20%, less than 20% of what alternative medicine is in the U.S.
And it's not regulated by the FDA. I'm gonna throw that shout out there. Next time you look at your vitamin C, there's a big label on the back of it that says this drug is not used to treat or diagnose any disease state, and it doesn't claim to treat or diagnose.
FDA says,
FDA doesn't regulate this. Please consult your physician. Blibby blobbity, and that's a disclaimer because supplement companies don't want to get sued.
And the other flip side to the whole supplement thing is that they can have radical side effects. We were going to talk about ginkgo biloba. That's
yeah. I mean, that was more of like a contamination issue, but like St. John's wort is like a very common thing that people use for like depression. There's a problem with that, right?
So people grind up St. John's worts?
Yeah. That stuff is a supplement and actually can interfere with a lot of actual drugs. Like you should definitely consult your physician if you're taking St. John's wort because
you should actually consult your physician about grapefruit too, which is
grapefruit can actually increase the concentration of some drugs in your bloodstream.
How much money does yoga and chiropractics make? You have that statistic?
So yoga and chiropractic are like two different. So together they make up about $8 billion. Exactly $8 billion.
And that together, that's about 18% of the market for alternative medicines used in the United States. Which is ridiculous to me. Like, don't get me wrong. Like, I'm all about yoga and stretching and being flexible.
Yeah, it's not going to cure your goddamn cancer though.
No, it's not. But at the same time, neither is homeopathy and progressive relaxation. I don't even know what that is. Jeez.
You mentioned something earlier. CBT is cognitive behavioral therapy, and I don't actually think that should be called an alternative medicine because it's actually you can get certified in cognitive behavioral therapy, and it has been shown to be effective in
Can you
autism.
describe what it is?
So pretty much like it's early intervention for people that are on the autism spectrum.
I guess, but at the same time, there's no real drug or Western medicine for autism.
Well, yeah,
it's just basically training, extra help,
right?
Whatever.
It's in. I mean, I wouldn't even call it. That's why I wouldn't call it alternative because the current.
And I feel like a dick because I called it some type of drug.
Yeah. No, CBT is cognitive behavioral therapy.
Okay.
But
I understand that. But there's a use for that. It's not necessarily curing anything. It's helping people on the spectrum.
Right.
Allow them to be in public and not get glitched out because of too much stimulation.
Also, for the kids that beat their head against the desk.
It's based on observational science. You know what I mean?
Right.
It's not necessarily saying, autism is caused by X gene.
Right.
That's not what happens with autism. It's based in scientific thought. Like, okay, this works. Let's use it.
That falls into the category of complementary medicine, actually.
Yeah. So it's not necessarily there's nothing wrong. Like we've been saying, complementary approach to this is not bad. It's just that when you go off and start listening to David Avocado or these guys, I wrote an article, and you edited pretty nicely in terms of the alkaline diet. It's BS.
Bullshit.
It is horrible BS. People have died going to special farms or special ranches where they're given baking soda in a saline solution into their IV.
Yeah, actually, I had a nurse say that to me last week, which was the craziest thing that I've heard in my life.
Don't get me wrong. I guess baking soda can have some type of placebo effect?
Well, actually, baking soda, because after this chick said this to me, I got to this whole Facebook debate associated with this.
I saw it. Did you know? I like how it was, oh, yeah, they're cured.
Yeah, baking soda and DMSO can be used in palliative care associated with chemotherapeutic-induced pain, but has zero effect on tumor growth. So, yeah, it's not...
You know what cures cancer?
Chemotherapy?
Bleach.
Yeah, I mean, yeah. Well, listen, anything...
In a petri dish.
Right, in a petri dish.
Don't
please.
start giving your loved ones bleach.
Yeah. Also, so we got a comment here. A lot of drugs were once from a natural source, e.g. aspirin. Actually, a bunch of our drugs come from natural sources. True. The problem is aspirin, which is acetylsalicylic acid, comes from willow bark. If you go out there to a willow bark and start chewing on it, you are not going to get the same effect as taking an aspirin tablet that has been synthesized and gone through what's called ADMET, which is absorption, distribution, elimination, metabolism, and toxicity studies. So we know exactly how much to give you for a specific effect. Don't get me wrong, natural isn't
and that's the
I'm not
thing.
opposed to that.
That's why I'm opposed for the rainforest being chopped down. It's because a lot of natural cures do come from herbs and things, but they need to be put through what we're going to go through is double-blind studies, clinical trials, and actually have statistical background with a placebo, where you can eliminate what people are feeling from the placebo effect in order to, gauge whether it's an effective treatment or not.
Right.
And a lot of people get lost in that. It's like, this Chinese herbal remedy is, curing my chronic headache. Well, yeah, it might, because it might have caffeine in it. Green tea, is good for a headache with an aspirin or whatever. And, I liked how you brought up willow bark, and it made me think of sassafras, which is actually
hell is that?
Sassafras bark. You can it's what you process into MDMA.
Oh, that's interesting.
Yeah. So you can't just go up to a sassafras tree, rip off the bark, and start chawing on it, and then you start, feeling all haly.
I mean, people chew
but
cocoa leaves in Colombia, and we get cocaine from it. Yeah, it's actually tooth pain and stuff like that. I mean,
but at the same time, it's not cocaine, but it gives you that
the cocaine's in there. It's chilling in there.
It's unrefined, but it's literally I don't know. It's like a cup of coffee to them. And then there's also in the Philippines or in Southeast Asia, there's that red root, whatever, the red thing that they chew on. It causes that gum disease, but it gives them a nice little natural high.
I've never heard of that, actually.
Yeah, I don't know what the name is. If anybody out there
on somebody
Instagram
let me know what's up
anybody
with the drug
on
stuff.
Pre-recorded show out there on Facebook and has the name of it, please let me know. We would love to talk about that.
Please hit us up, and we'll actually like to probably write an article about that, because I have a sudden interest in psychotropic drugs, and it's not it's not a personal interest, it's more of a scientific discovery thing, but we'll talk about that later.
So he says, wink, wink. So we've been touching on the placebo effect a bunch. So what is it? Placebo. What is a placebo? Placebo is a substance or other kind of treatment that looks just like regular treatment or medicine, tastes, smells, looks like it, but is not. It's actually an inactive lookalike treatment or substance. This means it's not a medicine. It's like, if Lee and I walked into the room and Lee's the medicine and I'm not.
I think there's some racial. So let's just talk about how active placebos are given. Usually, you have two pills. They have the same imprinting, the same color, the same shape. One is active ingredient, a compound, and the other is sugar.
Yeah, or it's something that tastes just as bitter,
or whatever the case. Some inert ingredients that your body doesn't do anything with but eliminate.
I thought we were family.
We're
I love you, man. A beneficial effect produced by a placebo, drug, or treatment that cannot be attributed to the properties of the placebo itself and must therefore be due to the patient's belief in that treatment is placebo effect.
Right.
Basically, it's all in your head.
Yeah.
Even though they don't act on the disease, placebos affect how some people feel. And this happens in up to 1 in 3 people. 33% of people actually take a placebo, a sugar pill, and feel like they actually have.
Well, there's an interesting thing, too, because if you look at clinical trial data, which I do every morning with my breakfast, you can see in placebo groups now. But if you ever do look at clinical trial data, you see...
No, you're not lying. You do literally look up clinical trial data.
You see in the placebo group, there's always a percentage of that group that has dizziness, vomiting, headache, all of these side effects associated with what they think a treatment would be, but they're actually not getting anything. And if you look at, so we can't give people nothing in clinical trials. So we give them placebo and then we give them drug, right? And we look at the beginning and the end point. In a placebo group, a lot of the times patients improve on their disease
So you
state.
said placebo group versus treatment group.
Right.
What does that indicate to you? What is that?
Well, that's clinical trial design,
It's a
right?
double-blind study.
Well,
It's a design.
It's a design.
of a clinical trial.
Double blind means the patient doesn't know what they're getting, and the
And-
doctor doesn't know what they're giving.
Yeah.
So
I think that's the best type of study, but you can't necessarily do that in all aspects of drugs, such as when we did the male hormonal therapy
Right.
for birth control. Is that you can't necessarily go into it double blind because you can't have a bunch of people thinking they're getting birth control and then all of a sudden they're spitting
Right.
out a bunch of babies.
I mean,
But-
we don't see it in cancer therapies a lot either. Cancer because we can't give somebody that has a cancer
Stage 4.
nothing,
Yeah.
right? It's usually the standard treatment versus whatever this new drug is.
Or it's adjuvant, where it's literally that standard of care
Plus this
whatever
other drug.
monoclonal antibody or a new chemical or an EGFR inhibitor.
So,
GF
I mean,
inhibitor,
that
whatever.
kind of makes things hard to, I don't want to say it makes it hard to decipher the true effect of a lot of these chemotherapeutics because, like I said, it's unethical to take two people, we both have cancer, I'm
But
going to
there
give
are
one
there
drug.
are
and you know that.
statistical methods and analyses that are really rigorous in the fact that, hey, if you give 20 people this drug and 18 of them actually have an extended period of lifespan, that's a good indicator that this drug is effective. And then you usually bring it out to a larger population and
Right.
see whether or not it actually has that effect. It's not necessarily, we gave it to 2 people, they both live 3-4
Right,
months
of course.
longer, so it's automatically.
And this is like very unique to cancer, other diseases, other disease states rather,
High
other
blood pressure
medicines.
is
Yeah,
different.
you can approach that differently. Usually those things are a little bit more robust. So there's also usually deaths associated with those studies.
So here's a little schematic about a double-blind study, and it's just real basic. You have 500 patients. You randomize them as much as possible. You give everybody a number, a letter, or some type of identifier, and then you basically say, okay, 250 get the drug, 250 get no drug, or they get the placebo, or whatever. And then you follow for 24 weeks, 6 weeks, 8 weeks, 20, a year, whatever, 2 years. And you basically compare the results of the 2 groups. And you kind of use the placebo group to eliminate any type of background noise that you would see in the
Drug group. So essentially,
Yeah.
if I give you some medicine and you improve, how do I know it's because I just didn't give you medicine?
Yeah.
So you look at the difference between the treatment group and your placebo group,
So
and
if
that's
you-
actually a real difference.
You have an increase of clinical outcomes in the trial group, the experimental group, say 90%, but the placebo group also has a 90% increase. Not an effective drug.
Right, drug's trash.
Yeah, it's garbage.
Yeah.
However, if you have 90% in the experimental group and then you have only 5% in the non-intervention group, then the drug's actually pretty good.
Drug's great. Most drugs are not like that. Actually, if you
It's
get
very few.
50% of patients to respond to a drug, you're doing well.
And that's also because of the difference in the population.
Right, and genetic diversity and all that
Exactly.
extra stuff.
And that's it. Actually, a lot of problems with clinical trials is that there's a lack of racial diversity, ethnic diversity, female-male studies, different things along that.
Yeah,
nature.
I mean, male-female, we're kind of coming over with that, but as far as just overall genetic diversity, it's
And that actually makes me think of an episode from House where House is treating a
House
patient.
MD.
Yeah, House MD. I know it's a silly little example, but
Oh, I love that show.
But the patient is an African American man, an older man,
Right.
who would respond better to medication B because it's not, it was designed for an African American population because I guess it was high blood pressure or some type
Yeah,
of
well,
cholesterol or
actually, beta
whatever.
blockers aren't as effective in African American population. Neither are ACE inhibitors.
I didn't know that.
Yeah, that literally has to do with genetic diversity associated with
Yeah,
that.
and actually, cancer therapeutics also has a difference. Downstairs on the 5th floor, I forget her name. She's an MD here at Jefferson that actually looks at the clinical outcomes of the same drug in African American populations versus Caucasian populations and Hispanic populations and Asian
Right.
populations. But she's an African American woman. And that's like her, project. So that's what she really wants to, see.
Yeah, I mean,
and
because it
try-
matters. I mean,
It does. But at the same time, it's not like it's a black guy drug or a white guy drug or whatever. It's just if your
I want all the
genetics,
black guy drugs. That's
yeah, right. I want the white drugs.
yeah.
But it's just basically
I mean, ultimately, it's genetic diversity. It's inheritance. It's overexpression. It's the way that biology works. But yeah, this is why we need very large clinical trials to know if a drug is actually going to be effective in the population.
And that's
but
why
it's also
you
really
usually
expensive.
see a whole bunch of like 884 in this example, and then 121 are randomized because you have what's called exclusion criteria as well. Actually, the paper that I'm going to be giving Journal Club about the CAR T therapy in glioblastoma, the exclusion or the inclusion criteria rather is garbage. They actually wanted 30% of the biopsy to contain an EGFR variant, EGFR VIII.
Yeah, it's V600E. Is that mutation?
No, that's
Melanoma.
BRAF. Yeah. But it's in glioblastoma where if you have this increase of a truncated version of the EGFR receptor, which is a type of receptor in the cell membrane of your brain cancer, if you have 30% of the cells having it, or have 30% of the overall population of EGFR having this, they thought that was the best. But they allowed as little as 6% in. So that exclusion criteria is kind of garbage. But Lee, this is kind of like your bread and butter here. So I'm going to let you take a little crack at the clinical trials aspect and the summary of the phases. And I know that we are in the preclinical stage.
Essentially, most research at universities is considered preclinical, unless you're at a very big medically infused university like TJU or Harvard or whatever the case may be. But yeah, the reason why this is important, why clinical trial this stuff matters, is because, and the reason why we're talking about this in regards to the reason why we're talking about this in regards to alternative medicine is because this process doesn't happen with any drug that's in your food market, Walgreens, GNC, CVS, Whole Foods. I fucking hate that place.
Although Amazon bought it and the prices are this much cheaper.
But yeah, I mean, so just looking at these as we go through these steps here, pretty much how clinical trials work is that guys like me and Dave start working and stuff in a laboratory. We do what's called in vitro studies, means that we take cells, we play with them, they say hi to us, we say hi back.
Or they get really angry and they're finicky and they hate us.
Right.
Just like women.
Sorry,
for all
can't
you
fit
know. Yeah, I know, right? Oh my God.
So yeah, then we move into animal studies, dogs, chimps, which has been kind of phased out, rats, mostly mice, rabbits, whatever.
They still do primate studies.
So yeah, then
actually because of thalidomide, you need to do primate studies.
Yeah, but chimps specifically have been phased out by the NIH. Maybe bonobos and
bonobos. No, bonobos
master,
are,
whatever.
It's I think you can use macaques.
There we go.
I think you can still use
Macaque.
What's the Ace Ventura monkey?
I don't know.
Really?
I know the movie. I don't know what that monkey is. I mean, not to get sidetracked. Anyhow, you can use animals, these primates or whatever. So then we go to in vivo, and then if the animals that have a human-like disease state get better, then we can kind of move into human trials, right? That thing. So yeah, then phase 0 is pretty much safety. Does this drug kill people? No.
And you usually give it to like people like Lee and I, who are generally considered
healthy, right? And a healthy individual, we give you a drug, see if your liver falls apart. Most of the time, it doesn't. Most drugs make it through this part because they don't kill animals. If they kill animals, they will never make it here. Then you get into phase 1.
That's for ADME.
Right. Try to find out the actual, what we call pharmacokinetics and pharmacodynamics associated with this drug.
What does it affect in your body? How does your body process it? Has your body either pee it out, poop it out, whatever?
Right. Distribution.
We talked about ADME in a different context, but we'll get through because we got to get to the
right. So then phase 2 is essentially small scale efficacy. You take anywhere from tens to hundreds of people to see if this drug actually works against this human disease state. If you have foot fall off disease, and this drug is for that, does it actually stop your foot from falling off, right?
That's great.
And some small scale, right? Does this happen? Does this work, you know?
It's usually 2A, and then 2B, you expand it out to a larger set, you go to a different set of like different areas. So a lot of clinical trials aren't just at one hospital. They'll be at like a series of hospitals, a series of locations to try to, like my point earlier was to increase the diversity and the amount of people in like different populations. Even like somebody living in Arizona might have a different response.
Unless your disease state is super rare, or if it's like cancer.
Yeah. They try to do this as much as possible.
Right. So for normal stuff, hypertension, whatever the case may be, multiple hospitals, big system approach. Then you get to phase 3, which is like, let's get everybody we possibly can with this disease state in the area.
Different countries, you know.
And let's see if it really works. Most drugs fail at this stage.
Yes. And at this point, you've already invested hundreds and hundreds of millions of dollars, whether it's in, you know, getting the trial set up at different locations, you know, actually manufacturing the drug. Even the cost of just bulk going from our level of making a small amount of drug to making, you know, like a couple grams of a drug, maybe like enough that you would put in a cup of coffee in terms of sugar,
Right.
to kilograms, pounds, hundreds
Right.
of pounds of
Tons,
the drug,
probably.
and then shipping that to the different locations. Say it's like insulin, you have to keep it refrigerated. So there's so many small costs that a lot of people don't realize when it comes to pharmaceutical drugs. And I'm not being a pharmaceutical Big Pharma shill. Yeah, I know. I'm still waiting for my check, Mark. But like the whole thing is, you don't see these hidden costs in the whole grand scheme of bringing a drug to market.
Yeah. Plus, this process takes about 10 years to do.
Yeah.
From inception, like, oh my God, shiny new idea. I want to put it in a person. That's about a 10-year difference from that thought to actually getting it inside of a person.
Yeah.
But we highlight this process because this is our gold standard for putting stuff inside your body. And supplements don't have to do this.
Yep. Or acupuncture, like we see right here. You can put a blindfold on guy A, put a blindfold on guy B, and they don't have skirts, so I'm assuming they're guys. Is that Cam Newton-esque?
That's, oh my God.
I don't know.
Cam Newton, I forgive you. It's okay.
Well, I guess you're just you're a manist chill. But like literally, they used a needle and they used a toothpick and
Right.
did the same type of thing, and it literally did the same effect.
Yeah, it doesn't work.
And the science, like people say that it helps with low back pain, neck pain, headaches, other conditions, and you know, I don't believe it works personally.
Well,
but I know, you know, I have my older roommate. She swears by it, you know, and she does other things. She stretches her foot, but it's all like a process for her to like.
I think it's.
Pain.
I mean, when we say whether something works or not, I think normal people. I wouldn't consider me and Dave normal because we're weird, and scientists are weird.
Yeah.
When we say whether or not something works, it's does this treatment or does this drug do what it's supposed to do, physiologically speaking?
Yeah.
I'm not asking or not whether you get better, which is a very different question, right?
Mm-hmm.
Does rubbing peanut butter all over my body get rid of my headache?
If it does for you.
If it does for you, then technically it worked.
Because
is
you
the
know
peanut butter doing
it?
anything for your
It's
headache?
releasing endorphins. Literally, you know,
I
because
mean-
if you get some type of, you know, because you can release endorphins.
Yes,
Rubbing my back will
That's
kind of be weird, but but you'll see we're weird. But it'll release endorphins.
that's
It'll
what
feel good.
happens.
That's
Yes,
massage.
but it's not the peanut butter.
It's exactly
Right. If you swapped peanut butter for jelly or Vaseline,
Ooh, you're into some
Maybe-
kinky stuff, huh?
maybe if you rubbed it, if your thing was that's what helped your headache, it wouldn't matter what the substance was, as long as it was probably of the same viscosity and brown. Maybe I don't know what you're into, but this is the different question between.
It's in this
what's
case,
working
it's going from needle to toothpick.
right. So that means that it doesn't matter whether it's the needle or the toothpick. It's not about
But
that.
I can see the whole like thought process about, you know, you hitting certain pressure points. Like when I have a headache and I pinch here, maybe it's placebo. But you know, like
I mean, we've been conditioned to think that that has an effect.
yeah, and if it's conditioned that way, then yeah. But I'm not saying because you have chronic migraines that you shouldn't go see your whatever
Yeah, your physician.
neurologist and figure out what is
Yeah,
actually going on.
especially if you look at light and you have halos. There's drugs specifically for that. It's called like sumatriptan or something. Like we have drugs for that.
Drugs,
We just have drugs for that. So
But you know, like I can see actually having an effect. You know, even if it's, you know, because you're touching somebody. This next thing, I'm gonna cure Lee of his cancer.
right. This is also right. What is this? Reiki? Is this Reiki?
I don't
This
know
is
the
also
pronunciation, but-
synonymous with prayer healing or something like that. Which I'm not religious, and if you are, great. But if you break your leg, there is no prayers that is going to fix that. And Reiki is the same thing. Reiki is not a religious concept. It has to do with energy points in your body and all that jazz.
She and
This doesn't have I'm taking your physics. This shit doesn't exist. The things that they're talking about don't actually exist.
There's no way to measure this. There's no way to like actually go in and see. But at the same time, if it makes you feel better, have at it, Austin.
So there's a person on my live feed on Instagram saying this point that maybe acupuncture releases endorphins, and endorphins are, helping reduce pain. Yes, that's probably true, but it's not actually the acupuncture that is the thing. The entire premise of acupuncture that it's going in and stopping or activating a nerve or stopping a nerve from functioning, that isn't true. So that's when we say this actual mechanism doesn't exist, therefore the treatment doesn't work. Whether or not, again, it could have been peanut butter.
Yeah, it could have been a tooth. Like, that's the thing. Like, they actually did a double. There's definitely studies out there. When we get to the last slide, I'll actually say the website's name. That's through the NIH. There are studies in clinical trials, like not clinical trials, but at least double-blind studies or some type of study where they literally stuck people with toothpicks rather than the actual acupuncture needle, and they had the exact same effect. They literally stuck a whole bunch of toothpicks in people,
right?
And it had the same effect.
Not in people, just against the skin,
whatever,
unknowingly to them.
But at the same time, it's just like it may have a benefit, but it's literally all in your head.
So I have a lot of physician friends who I get into this debate with a lot because, in their perspective, if it's you want to go home and put peanut butter all over your body, it's and as long as you stay on the main treatment, they don't care what you do, and they're actually not going to say, I have a problem with what you're doing because it's not harmful. And the reason why the supplement industry and alternative medicine and herbal stuff gets away with a lot of stuff, most of the stuff doesn't work. It actually is non-functional. There's a bunch of studies that we have here that we'll put in the comments for you. Just to mention one group, one lab went into a health store, got 44 different supplements, did something called DNA fingerprinting, which is essentially a way to match up DNA samples with known elements. So if you've got cherry wheat grass extract, they tested it for cherry wheat DNA, whatever. And a lot of times there was nothing in there, or what they said something different, or doesn't have it in there. So a lot of times it does nothing, and because it does nothing, we're allowed to sell it to you. Actually, for the FDA to take a supplement product off the shelf, you have to get sick. It has to do harm to you, and then you have to report it to the FDA, and then they'll look into it. Otherwise, you can actually, if you have enough money, you can put Dave and Leave's butt extracts on the shelf, and people will buy it if we have a great marketing team.
I don't know if I can. I guess, yeah.
I don't think there's a marketing team that can do that, but you get the point that I'm trying to make here.
People eat some weird stuff, man. What is it? Vanilla flavoring or cherry flavoring or something has come from beaver butthole?
I don't know.
No. Beaver scent gland is actually used as a replacement for vanilla.
I don't know if that's true. I'm telling you. Well, I guess
beaver scent gland.
Beaver. I have a friend that ate a beaver once, and I'll tell you that story at a different time. Anyhow,
it's vanilla. Yeah. Google. Thank you, Google. Yeah, it's vanilla. Beaver scent gland actually has a compound in it that actually tastes like vanilla.
Wow,
but if you actually smell beaver scent gland, it's like.
I mean, I put vanilla extract in my pancakes all the time. That's hopefully not the same thing. It comes from
traditional Chinese medicine. It's basically herbs, Tai Chi, acupuncture. It's a whole classification of all these different things that we've been talking about. It's all BS.
My boy Steve Jobs had PDAC, pancreatic ductal adenocarcinoma. He tried to juice his cancer away. And you know what? He's like one of the most intelligent human beings.
He also took chemo and did all the other things.
Wait, after the fact, he tried to juice first, which is probably why he died. Even though PDAC is super aggressive. But you're not going to die if you have PDAC. Just go try early detection. I don't want to say that. Some people do survive, like 7%. Anyhow, Steve Jobs.
I'm not taking those odds.
Steve Jobs tried to juice his cancer away for whatever reason. As somebody that's very intelligent, I couldn't understand why he would try a mythical approach such as this. But
smart people can be persuaded to do dumb things.
And this is the reason why we're doing this show is because, hey, if you've got something wrong with you,
I think juicing and eating healthy and there's these cancer centers of America or whatever, but they use chemotherapeutics, they use adjuvant therapy, they use monoclonal therapy.
Right.
They use things that actually target the disease, but in conjunction with that, they make you live a healthy lifestyle. They make you exercise.
Because it's important. It is.
They make you do yoga, but they also make you eat very healthy. They'll make you juice. They'll make you eat a well-rounded meal.
They have counselors. I mean, if you look at like I mean, we're saying like if there's clinical trials that exist, we're gonna link all these clinical trials here because it's hard to name all of them. But clinical trials show patients that have more positive outlooks on treatment and on their disease state actually have better outcomes. So take patients that are depressed. I mean, it does matter.
So I'm not saying that these things, all these alternative medicines don't necessarily, I don't want to say they don't work.
A lot of them don't work.
Yeah, I know what you mean. But at the same time, if you believe something is going to work, it has a benefit to you. And I'm not saying, like, you know, what is it? Mind over matter or whatever, you know? It's, if you, like you said, a positive outlook. If you have the will to fight, like honestly,
I agree to some extent.
There's actually, what is it? And the opposite is true. Broken heart syndrome.
I mean, there's also nocebos. There's an assumption that if a drug is going to hurt you, say you're super skeptic about medicine, which a lot of people are. They don't like taking pills, whatever. They're super skeptical about it. They take a drug and they get stomach aches and cramps and all of it, whatever. We see this in placebo trials. We give people placebo and they have chronic diarrhea.
Yeah, because they're told they're going to have chronic diarrhea.
You know, because they read online their friend had chronic diarrhea when he went into clinical trial. You know, your brain will do things to you. Yeah. But the point I want to say is that you can't have like a blanket approach to like, if I think it's going to benefit me, it's going to benefit me. Don't get me wrong. A lot of chronic diseases you can solve on yourself. Hypertension, unless it's like largely familial and associated with your family, but if you have great eating habits and you diet and exercise, the likelihood of you having hypertension is largely reduced.
Type 2 diabetes.
Same with type 2 diabetes.
If you eat healthy, you don't eat a lot of sugar, you exercise regularly, you can limit the amount of symptoms that you have. You won't necessarily cure yourself because the damage is, in a lot of cases, already been done.
I mean, you will always have some level of insulin insensitivity if you have been diagnosed with type 2 diabetes. But you may get to a point where you're not taking drugs. You're not taking metformin, glimepiride, or Januvia, whatever the case may be.
You can actually even eliminate the amount of insulin that you take as well.
Or if you're type 1. Right, don't get me wrong here. If you have type 1 diabetes and you don't take insulin, you're going to die.
Yeah.
You're going to die. If you are exercising, eating a well-balanced diet, that versus eating whatever you want, not exercising and being obese, those will have an impact on how much insulin you need to maintain your blood glucose.
Actually, they say gastric bypass actually kind of cures type 2 diabetes because you're not intaking as much calories and you're not taking as many carbs and sugars. But I just want to touch real quick on homeopathy. And basically what homeopathy does is, and we're going to have actually a full episode on just homeopathy because it's horrible. It's basically taking whatever compound and throwing it into not even just an ocean, but the entire like solar system worth of water and saying this is going to cure you. And the whole idea is less is more. And I don't know about you, but I've taken one ibuprofen or Motrin or Advil, and it hasn't given my headache or back pain any type of relief. But if I take 2 more or 3 more, 4 is prescription strength, don't take more. Talk to your doctor, see what you got to do.
Yeah, I mean 800 milligrams is the max you can take at one sitting.
If 2 works, great, you know, but less is not more. You know what I mean?
I mean, there is no data in any study done by any university ever that supports homeopathy as practice. So I have a comment over here that says, cancer grows in an unbalanced environment when homeostasis is not established. Some of those methods reestablish homeostasis. All right, that's not necessarily true. Cancer grows in the same context that normal cells grow in, and it really has nothing to do with current homeostasis. If you have an oncogenic assault, UV,
you
whatever the
literally
case
can
may be,
have
there's
certain microenvironments that are hypoxic. You're going to have certain microenvironments that are acidic. You're going to have microenvironments that are alkalinic. That's the whole thing that goes against the alkaline diet. There are basic environments in which the tumor can grow.
Right, like the intestines. I mean, also let's get this. There's also a common misconception. Healthy people get cancer all the time.
Yeah.
Healthy, fit people get cancer. It's not like you have to be
people who eat an alkaline diet get cancer.
Yeah, like everybody can get cancer, especially at the old age. You can be healthy in your life. You're 75, you can get prostate cancer.
It's kind of the downside to having, trying to cure cancer is because certain cancers live in certain environments, like PDAC, pancreatic ductal adenocarcinoma. They literally are in a desert of nutrient deficiency. However, Other cancers, such as breast cancer or colorectal cancer, live in a plentiful environment, like tropical rainforest. And if you attack one just like you attack the other, you're going to kill the patient much quicker.
Right.
And that's the whole thing. Is like cancer is not just one disease; it is thousands of different types of diseases with another 1,000 different subtypes of diseases. And that's kind of like why a lot of people are looking at trying to pull up cancer by the root. By looking at inhibiting DNA. That's why chemotherapeutics are DNA targeting molecules.
Even though I'm a fan of the old school drugs, they work. They have horrible side effect profiles. That's the problem. That's why we have new therapies. Right. That's why immunotherapy is very popular. I think that the next generation of cancer treatments are going to be a combination between immunotherapy and classic chemotherapeutic drugs, because that's what's going to keep the patient alive and kill the cancer. There's a question here about how I feel about dairy consumption and is this linked to disease. There was a big myth a few years ago associated with dairy consumption and type 1 diabetes, but clinical data has disproven this because we consume...
It all depends on the population that you're from. If you're from a Northern European type of population, you're more accustomed to eating dairy. But if you're from a Sub-Saharan African population, you're more likely to have negative consequences, such as...
as far as lactose intolerance,
that's
so most of the world is lactose intolerant.
Or an allergy. You could have a dairy allergy. But to say that a blanket statement upon which that everyone is going to get a negative side effect from dairy is just not true.
It's not true.
It's just not true.
But
I drink a gallon of chocolate milk over the course of the past 2 weeks, and I'm not dying. I'm not going to get
I'm like partially lactose intolerant, so I don't really drink milk that much.
But yeah, that's about it.
So look, most of the world is lactose intolerant, which has nothing to do with any other disease state associated with any other disease except for indigestion and farting and stuff of that sort. There are milk allergies, which is completely on its own. But as far as drinking milk causing some disease, like I said, milk consumption is lower in this country, but we still have an increasing rate of type 1 diabetes. So that link is anti-correlative and has been disproven. I don't know if any other diseases associated with milk that are actually based in evidence. There's some stuff associated with IGF and milk consumption and cancer.
It's more of an immune response, but you're not going to cause an autoimmune disease. You're not going to get Crohn's, or you're not going to get ulcerative colitis or IBS. You might get IBS, but that's from you having lactose intolerance. But that's not necessarily true IBS where you're going to have an autoimmune response. But we're going to wrap up a little bit. If you have any questions, we're going to be posting this non-live on Facebook and YouTube. So if you have any questions, we're going to address that in the next show. I just want to point out that the website is the nccih.nih.gov/health/integrative health. If you just go to nccih.nih.gov, you can get all the information that we provided here. And all the other references are here from the actual websites of alternative medicines, and I looked at them and I tried to understand them a little bit better from their perspective. It's kind of like when you go into a debate with somebody, you want to know the other side, so you read what they actually put out and different things like that. So I'm not saying to not do these things, but consult a proper physician, consult a dietitian, consult a personal trainer, consult whomever that you feel is adequate enough to give you the benefit of your own health.
So I'm going to read a quote just because this guy named Paul Offit, who's an MD, kind of embodies how I feel about alternative medicine. The quote goes, some thought that this NCAA work was far outside of the mainstream. Paul Offit says, my problem was that they were funding studies on things like distance healing and putting magnets in your mattress to improve arthritis. This guy's the chief of infectious disease division at CHOP right here at Children's Hospital of Philadelphia. There's no way this could work because the iron in your blood is not magnetizable.
That's true.
So when I a lot of the times I get kind of backlash from this, well, how do you know that's not going to work? How do you know taking this, beetroot, butthole, whatever?
You're going to shove beetroot up your butthole?
There's just no basis in biology, chemistry, physics associated with how this thing could possibly work. And if you do get a benefit from it, it's up there. So
if it's all in your head,
stop spending money on alternative stuff. Could this be my don't do alternative medicine dance? Can I work with this thing real quick?
The whole thing is, if it works for you, it works for you. But it's in your head. Don't go around saying that. Don't take your medicine. Don't take your statins. Don't take your chemotherapeutics. juice, do alkaline diet, whatever. Yoga, Tai Chi, chiropractic. If it works for you, cool. It gives you some type of benefit, awesome. But there's no real proof that it actually does anything other than make you feel better in your head.
Right. Aside from chiropractic, good for it.
So next week, we're going to be talking about something that actually does have a pharmaceutical property. We're going to talk about the juice.
We're going to talk about why Dave's bigger than me.
Oh! Not really, but you know.
So, we're going to talk about our baby cousin over here, Arnold Schwarzenegger Jr.
I wish.
And so we're going to be talking about anabolic steroids.
So we're going to be talking about testosterone and D-ball and tren and
stanozolol and
all this stuff.
There's a lot of them.
Yeah, there's
oxandrolone. There's a lot of them.
Jesus. But clomidine.
Clomid and
Clomidine.
oh yeah, Arimidex.
But Arimidex has therapeutic qualities in breast cancer because it's an anti-aromatase.
Yeah, it works great if you have breast cancer, but if you don't.
Well, actually, my dad takes it as hormone replacement therapy because he has low T. Basically because his aromatases are really high.
I think low T is a weird disease state. This is my own personal opinion.
My dad has a T score of 42.
I'm just
literally,
saying.
You know what age group has a T score of 42?
65.
87. My dad has the testosterone levels of an 87-year-old.
How old's your dad?
When he got first put on T therapy?
Yeah.
46.
I mean, he's not having any more kids. He's cool. I mean, he's good. As long as
he just wants to feel like crap.
I mean,
so we'll talk about that. We'll talk about hormone replacement therapy. We'll talk about a whole bunch of stuff next week. But if you have questions until the meantime, leave them on the Facebook comments. We'll address them in the first 5 minutes, 10 minutes of the next show. Yeah. And we'll move forward like that going, for the rest of the shows and see how that format works out. And maybe we'll jump between live and not live and see what our schedule is.
See how it looks. Also, I'm going to produce a list of bodybuilders that have perished in the last few years for unknown reasons. I think I have a pretty good reason of why these guys are perishing at young ages, but everybody in the bodybuilding community thinks it's everything but the stuff that everybody else does. So if you also want to compile a list and do some research for us, please send it over here and we'll definitely shout these guys out. And it's unfortunate that these people have perished. It's not to make fun of them, it's actually to be informative. Yeah. Because if you're doing testosterone, you should have a very close relationship with your physician.
Bring up the WWE as well, and then even the NFL.
Yeah.
A bunch of stuff like that.
So,
all right, everybody. Thank you for joining us. We'll see you next week for the juice, anabolic steroids. See ya.